Kirk Allen.
Thank you, Chairman, members of the board. Several years ago we came, my name is Kirk Allen, I'm with the Edgar County Watchdogs. Several years ago we came to the board and we addressed policy issues with compensation related to public officials. And although we were met with some resistance on some of the compensation being received that was not in the original resolution, steps were taken to correct what we identified, and you guys move forward. And I appreciate the fact that it was recognized. Well, what brings me here today is leadership. You all said the Pledge of Allegiance. Pop quiz. Last 3 words. Justice for all. Let that sink in for a minute. No matter what your political affiliation, we always talk about our constituents, what we're doing for the taxpayer. We're here for the taxpayer. We're here for the taxpayer. Over here on the right, we have a table, members of the press. Mr. Sanchez, and I'm not familiar with the other lady. How many folks from the press have we got in this room today? 2? Okay. Leadership starts at the county levels, because we know we don't have it in Springfield, in my opinion. That leadership deals with how you do your day-to-day operations. As a watchdog, I can tell you I can't keep up. We get literally 30 to 40 tips a day on corrupt government operations statewide and now nationally with the creation of what we call the American Watchdogs, a training organization. From a consolidation point, when we don't have enough watchdogs or members of the press to address things locally at all these lower units of government, we've got chaos, and it's a mess, and it's killing the taxpayer. But there's a common theme that I've been hearing for the last 7 months here in Illinois dealing with local government and public officials and their compensation. They constantly say, well, the county does it, county board does it, county board does it. And the one in particular that I'm going to address is health benefits for county officials. County elected board members have the option of health care. They also are paid substantially more, and I know every county has different pay structures, but the taxpayers are paying that bill. And when the taxpayers pay that bill, that trickles down all the way to townships where you have elected township boards and supervisors that literally come to one meeting a month and have a full carte blanche gold package of health care. And they say, well, the county does it. So what I'm asking you folks today to think long and hard about as you move forward through your future compensation setting resolutions along the lines with consolidation options is, number one, we need to lead by example. And part of that is, can you afford to use your compensation of wages to buy your own health care? I think you can. I think most public officials can with what they receive. The taxpayers are not receiving anywhere near the optional programs at the cost that you folks can access. So literally you're living an entirely different standard than most people out there. And from a watchdog standpoint, everybody is pointing to the county boards statewide saying the county's doing it, so it's okay for us. And I agree, the law says you can do it. The law says you can do a lot of things. But I sat through a finance committee and I heard something in regards to conflicts and the questions being raised about conflicts of interest. Well, the law is real clear. Officers Prohibited Activities Act, Section 3. It tells you what a conflict is. It's spelled out crystal clear. It's no confusion. That's the standard that gets applied. But we see, and we've seen it here, we've seen it everywhere else, when conflicts are identified, we either fix the problem or we go change the law. We don't need to change the law to protect wrongdoing. And it's the same with the policies of how you compensate and put benefits in your own pocket for your family. And I understand we all have families, every situation is different. But that's part of that leadership role, and the example you set trickles all the way down statewide. And it'd be nice one day to be able to say, it's not happening anymore because it's not right for the taxpayers to carry that burden. And it's so bad, Chairman, just as a point of interest statewide on a consolidation point, I've got townships that not only have health insurance, the taxpayers are paying the deductible. Now, I noticed some shocked looks, but yeah, they're paying everything. And they sit back and say, well, the county board does it. And it's not just you guys. I'm not picking on just DuPage County. This is a problem statewide, and it's an excuse that we hear statewide. So I would urge that you folks address that. I really would. Thank you very much.
Okay, thank you. We move on to the next item of business entitled Old Business. Anyone seeking recognition on the order of Old Business? Mr. Elliott.
Mr. Chairman, thank you. I rise today to address an issue that I've raised before in the County Board, and I'll raise it again today in the hopes that we can finally do something about it. And that is the question of taxpayer-funded health benefits for County Board members. I would like to see us eliminate this benefit for County Board members, either by resolution and formal action of the Board or by voluntary action of the County Board members. I suggest this for two reasons. Number one, the health benefits for County Board members are really expensive. Currently, we have 11 members who take either the health or dental. And the cost of that to the county and the taxpayers is about $185,000, which is about $17,000 per board member for these benefits. $17,000. That $185,000 could be available to fund any one of a myriad of uses at the county. As the chairman of economic development, I'm scrambling to find an extra $30,000 for funding for the DuPage Convention and Visitors Bureau, for programs that have a demonstrated track record of returning on investment. I can't find those funds. We need funds badly for opioid usage, combating opioids. We need it for election equipment. We need it for public safety. And I would hope that the board members here could see fit to clear up that $185,000 so that the taxpayers can benefit, rather than the elected officials from those funds. Second, I want to point out the inequitable nature of elected officials taking health benefits. We have part-time jobs on the county board. These are part-time jobs. In the real world, nobody gets health benefits for part-time jobs. Our constituents don't get health benefits for part-time work. That's a reality. Why should we as public officials get that? It's not fair. Second, I will point out we're well compensated. We make about $52,000 a year. I did some research to try and determine what the median income is in DuPage County, and I found a number of different studies, some from the Census Bureau, others based on data that came from the Census Bureau. But everything I said found that the individual median earnings for a person in DuPage County were between $38,000 on the low side and $50,000 on the high side. Which means we as county board members receive more money for a part-time job than the median person in DuPage County earns in total. How can we in good conscience then go ask those taxpayers, who, by the way, earn less than we do, to also fund our health benefits? That is grossly unfair. And you know what? We know it's unfair. I've looked at everyone's materials from when they ran for office, and I observed a lot of the campaigns. Nobody runs for public office in DuPage County telling the taxpayers, by the way, I'm taking those health benefits because I'm entitled to them. No, in fact, it's almost the opposite. Many people run for public office arguing that county board members get paid too much money and that county board members shouldn't be taking health benefits for part-time jobs. And then guess what happens? They get on the board and they either take the benefits or they sit silently while other people take the benefits. I want to end that practice. We should deliver to our taxpayers that which we promise on the campaign trail. Now, I want to make something very clear. I am not seeking to deprive county board members of the ability to participate in the county plan. I recognize that many people here maybe are parts of insurance pools, or they have employers or other options that aren't as attractive as the county's health coverage. We're very fortunate, as we heard today, to have 2,300 or somewhere thereabouts covered lives in our plan, which means we can offer very attractive insurance. So if county board members want to participate in the county's plan, I have no problem with that. But county board members ought to pay the full freight associated with that. They should be willing to take out of the $52,000 that we get for part-time work and pay the full freight for the health benefits. That just seems fair. Again, I would ask that this either be done by formal resolution, or if not, then by voluntary action on the part of the county board members. But I do think that this practice should end. Thank you.
Okay, further discussion on the order of old business, Member Ozog.
First of all, I want to address this issue. My family is currently in transition. My husband will probably be retiring in the near future. Having health care is offered by an employer. I believe some of our members here are signed up for a pension that is being received by part-time employees. So we are contributing toward that pension. That's one point to make. But in terms of availability, this, first of all, is not an issue that we really need to discuss until next April, when I believe that all salaries, benefits, etc., are discussed. I will also say I never on the campaign trail said that I would not avail myself of health care. I also want to say, in terms of taking the health care, I am currently paying $6,000 a year with a $4,000 deductible, so I would consider that well more than a half contribution to what I understand our benefit is. Now, the final thing I'd like to say is that in any of this discussion, everyone should realize that right now there is a federal lawsuit pending. It's called Azar versus Texas, and it is currently seeking to completely disband the Affordable Care Act. And under the Affordable Care Act, one of the protections is for pre-existing conditions. I have a pre-existing condition. My daughter has a pre-existing condition who is being covered under my care. And the other observation I can make is that I think you'd find very few families that do not have a pre-existing condition. And I personally think we need to table this discussion completely. I have no problem with coming up with a somewhat larger contribution, etc. But I think, first of all, we should talk about how much we're contributing toward pensions for part-time board members. And I also think that we need to wait until April for this discussion, because we need to see what's going to happen with this ACA ruling. If the ACA is completely disbanded, we have a far bigger problem. And our budgeting situation, as we discussed today from Karen Aiello, Medicaid expansion, etc., will all be impacted by that. But personally, my biggest issue is pre-existing conditions. And again, there is a pension here. Many of you, or a share of you, have signed up for that for a part-time job. So I think the other consideration is that all of us put different amounts of time into this job. Sometimes it ebbs and flows. For instance, the adult business that issue, Sterigenics, et cetera. Sometimes people are probably spending more than a full-time job of spending more of their time. So I say we discuss this in April when we're discussing all benefits, and thank you.
Further discussion on the business, on the order of business entitled Old Business. Were you seeking recognition, Member Chaplin?
You can let Member Rutledge go first.
Okay.
Thank you.
Member Rutledge.
Thank you, Chairman. I just want to speak to, I took a job in 2017 merely for the benefits, and at that particular employer, I only had to work 30 hours a week to be able to avail myself to their benefit package. So I'm not sure if I agree with the fact that nobody provides health insurance for part-time workers. The other thing I'd like to point out, too, is that that was a job where I went, I punched in, I did my job, I left, I went home. This is not a job like that. I check my emails multiple times a day. I have to be on call for anything that might arise that would need a county board member's attention. So It may be that some weeks we only put in part-time hours, but on many others, I believe we're exceeding that threshold for benefits. Thank you.
Further discussion? Member Chaplin.
Thank you, Chairman Cronin. Yeah. Actually, I do believe that this is a conversation that we will have in April or May when we do our benefits, because we approved our benefits and our salaries last 2 years ago when we were elected, so that is the appropriate time to be talking about it. And honestly, I do look forward to this discussion. And I just want to share my story. When I was elected in 2012, I did not take the health insurance. I went on the marketplace and I paid $369 a month for my health insurance. Once the new administration took place, the health insurance, they kind of gutted the ACA program, and each year it became more expensive. I eventually was paying about $700 a month for 40/60 coverage and a $10,000 deductible. At my employment, I worked a few extra hours so I could get the health insurance. Last year, my father passed away. I left my employment to help with my mom. And so unfortunately, I have to take this because my husband's health insurance will not cover me as long as the county offers it to me. So for me, if the county wouldn't offer it, that would be great because I can go back on my husband's great health insurance. Or I can look for another job with health insurance. But right now, unfortunately, and it is just me on the plan, it's not my whole family. But I think it comes to a bigger conversation of, maybe the county board, through our legislative committee, working with our state and federal reps on really finding good health care for people, because it is an issue, especially with people like Mary and now myself that have pre-existing conditions.
Okay. Further discussion. Mr. Elliott.
I just want to respond briefly to both those points, and I want to be clear on what I'm proposing. Because what I heard is, well, there's a lawsuit challenging the ACA. Well, there's been a lawsuit challenging the ACA since the ACA was passed. I mean, I can't remember a time where there wasn't at least one lawsuit pending challenging the Affordable Care Act. There have been so many challenges to that have gone before the federal courts of appeals and the Supreme Court, you can't even keep track. And so if we're going to defer action until we decide, until all the lawsuits involving the Affordable Care Act are resolved, we're going to be here forever. Second of all, I want to be clear. I am not suggesting that anyone has to leave the county plan. I'm not suggesting that they can't use the county plan and take advantage of the insurance with the pre-existing conditions and everything. I'm just simply suggesting that county board members ought to pay their way. We can afford to do it. We each make more money than the median earner in DuPage County. We can afford to pay for our own health benefits and not saddle our voters with having to pay them. That's the only decision. And respectfully, I believe what I heard is changing the subject, because it's a simple question. Who pays for the health benefit? Us or the taxpayers?
Member Ozog, are you seeking recognition?
Yes, I am. First of all, I am not changing the subject when I discuss contributions to pensions for part-time board members, because that is, again, what you may want to call a perk. On the other hand, I'd first of all like to know where Mr. Elliott's getting his figures for $185,000 total for 11 people. That seems considerably high to me. I am more than happy to talk about a higher percentage, but I think, first of all, that conversation should apply to all elected officials. And as well, I also want to point out that this Azar versus Texas lawsuit is considerably different. This lawsuit, first of all, the Trump Justice Department is not supporting the law of the United States, which currently is the ACA. They are not defending this in the courts as it goes along, and it's very likely, there was an article in from NPR 2 weeks ago that the 2 Republican and 1 Democrat judges, the Republican has decided to, or the 2 Republicans are not speaking particularly favorably of continuing the ACA. This was commentary made by a University of Michigan law professor in the article that I had read. I do believe we need to table this until April, and that will give us time to see what's happening with this particular lawsuit. We can't talk about it till April anyway. And I think it's important to realize that if we're going to offer a pension, then we should also acknowledge, too, that the board members are indeed already contributing significant amounts toward their coverage. And everybody has different reasons, et cetera. So I think that at this point we table this discussion until April, and let's see what happens on the federal front in terms of having people continue with the Affordable Care Act and its repercussions, et cetera. Thank you.
Further discussion under the order of business entitled Old Business. Mr. Hart.
Thank you, Mr. Chairman. I want to thank Member Elliott for standing up and raising this issue. It's an issue that we've discussed ever since 2018, and I support his decision to raise it in this boardroom today, and vehemently disagree with the decision to kick the can to April, because as we saw this morning in Finance Committee, we've already seen the rising cost of health care and the impacts that could potentially have on our own county employees. As leaders of this county, as leaders of this county board, I believe that we need to take the initiative and begin this discussion now to show that we're not above our employees and we're not above the taxpayers that put us here. Many of us ran on a commitment to not take these benefits. I think we need to hold ourselves accountable. I support Member Elliott raising this, and I would support this resolution if it were to come to the board. Thank you.
Okay, thank you. Further discussion? Mr. Krajewski.
Yes, thank you, Mr. Chairman. First, we got nothing under old business, new business, and I respect Board Member Elliott bringing it up, and we have mechanisms, get 6 signatures, put something on, and bring it before committee. But it seems like every meeting we have, we get to old business, we have nothing on there, and somebody brings up a good idea. That's fine, but let's take it to a committee and let's start discussing. We start debating items at every meeting under old business, and we get up and we start talking about it. A lot of them are good ideas, but nobody's got any information. We don't have any facts. That's why we have committees and we send stuff to committee. So I like it when we have old business people that raise an issue, but we shouldn't be debating it on right after that on the floor, no notice. We should send it to a committee. If our sick people want to discuss it, they put it on and we start looking at it and getting the information to do it. But every meeting now we have a debate about some issue, and then another board member, and half of us don't even have information that we can actually make a logical decision, but we start debating the issue on the floor. So I would like going forward, if we want an issue, that's fine, raise the issue, but let's get it to a committee, or if we got 6 people that want to discuss it, get it on the agenda, and let committees start discussing and let people have it, and have a debate on it, and make the decision on it. But this week it's out, but every week we have a debate back and forth with members on an issue that's raised under new business. Thank you.
Further discussion under the order of business entitled Old Business. Mr. Larson.
Thank you, Mr. Chairman. I'll try to be brief. First of all, I sort of agree with Member Krajewski there that we are doing this a lot. And while I recognize there are good and important ideas to be discussed, it does become a little disorganized when we get into debates and talk about tabling issues that really aren't for a vote at this point. But by the same token, I did want to point out, since we're having this discussion, there are those of us who neither take the pension nor the health care benefits. Having said that, I don't want anybody to look at this and say our fellow board members are wrong or they're doing something wrong in taking something that was made available to them. I do think it's an issue, just as I opposed the continuation of pension benefits for board members a few years ago when that issue came up. I didn't take any shots at my fellow board members. They made the decisions they made on behalf of their families for a benefit that was available to them. And some of them couldn't opt out at the point that the discussion was made. So, and the same issue here, Member Chaplin talked about her family situation, Member Ozog talked about hers. Those are difficult and personal decisions, and I don't think that they should be criticized for taking advantage of the opportunities that they had. But on the other hand, I do think, as an advocate for the taxpayers of the county, it's a discussion worth having whether we should have this for this job. So that's all I have to say. Thank you, Mr. Chairman.
Okay, thank you. Anybody else seeking recognition on the order of old business? Old business, seeing none, hearing none. We move on to